డియర్ వదిలేయండి, అది పోనీ ఇప్పుడు పెద్ద ప్రాబ్లం
Let's
కాదు.
just write the let's start from this one. Hello, sir. Shall we start, sir?
మిస్ స్టార్ట్ చేయండి మిస్.
What?
ఆల్రెడీ 10:05
Okay.
అవుతుంది. Yeah.
Okay, sir. Thank you.
జ్ఞానభూమి ఏం కాదు.
A pleasant morning to our, a pleasant morning to our beloved principal, Reverend Dr. Sister Marietta de Mello, Vice Principal and PG Directors Dr. Sister Shaurilu, all the heads of various departments and respected staff, and my beloved fellow mates. Good morning to one and all. First aid is for everyone, everywhere. Due to this
ఇప్పుడు
pandemic
అయిపోతుంది.
situation, each and everyone, every individual came to know about the importance of first aid. Now, we, the students of 3rd BSc, are here to create awareness on first aid. A day without prayer is a day without blessing, and life without prayer is a life without power. Now, I call upon Sri Rupa to lead us in prayer.
You are my strength when I all in all. Seeking you, you are my all in all. Is your name, Jesus, Lamb of God, worthy. Bible reading. A reading taken from the book of Psalms, 37th chapter, 4th verse. Take delight in the Lord, and he will give you the desires of your heart. Proverbs chapter 15, 30 to 31 verses. The light of the eyes rejoiceth the heart, and a good report maketh the bones fat. The ear that heareth the reproof of life abideth among the wise. Prayer. Let us do our daily prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen.
Thank you, Sri Rupa, for invoking the blessings of God Almighty. When you provide basic medical care to someone experiencing a sudden injury or illness, it's known as first aid. We, the students of 3rd BSc of Zoology Department, are here to present the measures taken for various afflictions. I request Dr. R. Indra Ma'am, Head of the Department of Zoology, to give a preface on this webinar.
Good morning, one and all. First aid knowledge is invaluable. First aid knowledge is invaluable for both individual and for the community. It enables to assist persons who become injured in the event of an accident or emergency situation until help arrives. First aid skills can be applied in the home, the workplace, or in public locations. Therefore, the more first aid certified people are in a community, the safer that community becomes. It allows those trained with the potentially life-saving ability to assist an injured or ill person during a variety of emergency situations. First aid can and often lessens the severity of an emergency in a given time and place. While everyone can benefit from first aid knowledge and training, it is an even greater benefit to those working or living with individuals who require ongoing special attention or treatment, such as children, persons with physical or mental disabilities, persons with chronic illness, persons with disorders such as epilepsy, the elderly persons involved in recreational activities such as swimming or people working in dangerous environments such as a factory or construction site. This is that is why it is very important for us as many people as possible to have at least a basic knowledge of first aid. The main objectives of this national workshop on first aid are to give awareness on first aid to the community, to learn the students on different first aid techniques, to motivate and learn the mode of online workshop by the students, have a proper understanding of first aid as a part of their life aspect. The third year zoology students are outgoing students, have a responsibility of future mothers and citizens of India. So, this study
అవుతుంది
of
వెయిట్ చేయండి అది
first aid
ఆటోమేటిక్గా
topic is relevant as a
ఇక్కడ
part
టైప్
of
చేయండి
their curriculum.
ఇప్పుడు నేను ఇక్కడ నుంచి పెట్టాలా ఇది జరుగుతుంది
43rd year geology project students completed their online CUSA course on first aid and received their certificates. Each student was given a separate topic of first aid and they prepared and presented under Project Viva. More than 50 topics were included. All our students completed and excellently presented. Under the guidance of faculty and permission of Sister Principal, Dr. Sister Marietta Di Mello, 12 students of the same project came forward and selected this topic for their workshop to give awareness to all the students and also to public through Google Meet and also YouTube link. All the students were motivated well to complete Kursa course and also prepared PPT presentations on their own topics and presented exactly excellently well. This topic is so useful for their future life and also gives awareness to the local public through community development programs and also can give guest lectures to NCC and NSS students. Now, our students are ready to present their topics. I wish them wholeheartedly to give awareness to the public on this most important life-saving topic, that is first aid. All the best, girls.
Thank you, ma'am, for your brief introduction. Now, the students of 3rd BSc are ready with their presentations. I request CH Divyashree to share her knowledge.
Good morning, everyone. Good morning, one and all. I am Divyashree from BSc BJC final year. Today, I am going to tell you about thought stroke. What to do if someone has a stroke and its signs and symptoms? Three things to do when someone is having a stroke. Call 911 immediately. Note the time you first see symptoms. Perform CPR if necessary. Signs and symptoms of stroke in men and women. Sudden weakness in the face, arms or legs, especially one side of the body. Sudden confusion, trouble speaking, sudden trouble seeing in one or both eyes. Sudden trouble walking, loss of balance. Three things not to do when someone is having a stroke. Do not let that person go to sleep or talk you out of calling 911. Do not give them medication, food, or drinks. Do not drive yourself or someone else to the room. Stroke treatment. Call 911 at the time symptom of stroke can help you get to the hospital in time for life-saving stroke care. Thank you for thank you everyone.
Thank you, Divyasri. Now I call upon S. Shalini.
Good morning, everyone. Today I'm going to deal with the topic poisoning. Poisoning, in the sense we know, the administration of that harms the body. It is called poisoning. It may be occurred in different ways. The first way is due to swallowing. The things which are harmful, that when we swallow those things, it will be poison. And it also causes due to the inhalation of some poisonous gases. And also, we purposely, when we inject some drugs, also leads to poisoning. The effect ranges from short-term illness to brain damage, and sometimes it leads to coma and also to death. The ways of poisoning. Actually, we get poisoning through eating some food which is contaminated. In this slide, we can see a contaminated food which is eaten by an organism, and when we take the products from this organism, the person will be infected. That means the primary contamination occurs in the animal and the secondary infection occurs in the human being. In this way also we are affected by poisoning. Mostly food is contaminated by bacteria or virus. Moving on to the next slide, intake of chemicals. In household, we are using bleach, cleaning chemicals, which are getting into food. When we use for example, I would like to take HIT. When we use this HIT, when we are using this, the food which is uncovered will be infected with these chemical bleaches. So after a while, we are taking this food as our daily food and we will be affected. It causes due to chemical contamination of food and we will be the infected persons. Coming to the next slide, overdose of drugs. It is also some people attemptively do some injury to their bodies, such as taking overdose of drugs. This also leads to poisoning. And the affected person faces some symptoms and signs like nausea, diarrhea, abdominal cramps, headache, fever, and dizziness. Vomiting, in the sense, due to the poisoning, the person will feel heavy vomiting and obviously will feel dizziness. And diarrhea due to the harmful of stomach, and stomach is just ingested by some poisonous foods, so the person will be infected with diarrhea. And headache and fever also the symptoms, and also dehydration of the body occurs due to poisoning. And how we can treat this poisoning is by we have to take mild foods such as fruits and juices during these poisoning times, and also have to drink a lot of water which will be hydrated, and also antidiarrheals which are acting as a treatment for this poisoning. And first aid we can take for poisoning is avoiding some solid foods like which is fried and spicy and foods that are grease. After we are getting rid of this poisoning, we can drink a lot of water and fluids which will give us perfect strength. And also we can see the postures which are on the slide. These postures are very useful during poisoning and these help in getting speedy recovery. And the number is here to dial up the poison help. And first aid is the necessary things for each one of us. In order to rush to the hospital, a person as a very citizen, it is our primary duty to know the first step we have to take after the person is sick. So I feel and hope that it will be useful for you. Thank you.
Thank you, Shalini. Now I invite K. Anusha to show her presentation.
Good morning to respected teachers and my dear friends. Today I am here to share a few words about diabetes. Mm, Many people were suffering with diabetes mm, nowadays. Now I wanna tell you. Now I wanna tell you. Now I gonna tell you diabetes causes and first aid in emergencies. Diabetes mellitus, high level of sugar in blood. Sugar is the main source of energy that we use in our body. This disease affects millions of Americans every year. And then next slide, diabetes classification, diabetes type 1 and diabetes type 2, gestational diabetes, diabetes miscellaneous. Diabetes symptoms are excessive thirst, frequent urination, excessive hunger, weight loss, fatigue, itching of the skin, etc. And then next, diabetes emergencies are hypoglycemia, diabetes ketoacidosis, diabetes ketoacidosis, hyperosmolar coma. And the next slide, how to know if a person suffers from diabetes? People with diabetes should wear or carry ID information such as an electric bracelet that emergency medical staff can find. And the next slide, hypoglycemia symptoms are weak, drowsy, confused, hungry, dizzy, paleness, trembling, and sweating. And then hyperglycemia symptoms are headache, irritability, rapid heartbeat, cold, calming feeling, loss of consciousness, and coma. And the next slide is what to do if conscious victim looking for the signs and symptoms listed above will help to distinguish the two diabetic emergencies. In addition, if the patient is conscious, you can ask two very important questions which will help to determine the nature of the problem. And the next, have you eaten today? Someone who has eaten but has not taken prescribed medication may be in a diabetic coma. And the next question, have you taken your medication today? Someone who has not eaten but did take their medication may be having hypoglycemia. Distinguish between the different types of diabetes. Emergencies can be difficult. A person in insulin shock needs sugar quickly. If the person is conscious, get sugar in any form, candy, fruit juice, or a soft drink. Sugar given to a person in insulin shock can be life-saving. If the person is suffering from diabetic coma, the sugar is not required but will not cause them further harm. Remember, do not do give nothing by mouth if the victim is unconsciousness. Thank you.
Thank you, Anusha. Now I request C.H. Durga Devi to share her knowledge.
Good morning to one and all present here. I am here to share about the measures to be taken if a baby has a seizure. In this, we will see what is a seizure, causes, symptoms, first aid treatment, and things to be avoided. First, what is a seizure? A seizure occurs when there is an abnormal surge of the electrical activity in the brain due to the chemical changes in nerve cells. Baby seizure happens when an abnormal extra burst of electrical activity occurs between neurons or brain cells in the baby's brain. Imbalance occurs between excitatory inhibitory brain cells. Electrical systems in a baby's brain are not developed enough to cope up with the high temperature, and that is why they are more likely to have seizures. Next, what causes the baby seizures? Causes may include brain injury, infection, high fever, and underlying health conditions such as cerebral palsy. A baby's risk of fever-related seizures is higher when they are younger than 18 months. Next, symptoms. Symptoms include staring, stiffness of the baby, breathing problems or breathing completely stops, loss of bowel or bladder control, falling suddenly with no apparent reason. Sometimes it is difficult for parents or caregivers to notice the seizures in babies and young children as they can be subtle. First aid treatment include first, Keep calm. Stay with your child. Move your child from danger or remove any nearby objects near them. Gently place your child on the floor or ground and put pillows or soft padding around them. Lay your child on his or her side to prevent choking on saliva. If your child vomits, clear out the mouth gently with your finger. Next, loosen any clothing around the head or neck. Make sure that your baby is breathing normally. Don't try to prevent your child from shaking. This will not stop the seizure. Do not put anything in your child's mouth. Seek medical help or call for ambulance. If possible, note down the time of the length of the seizure. Next, the things to avoid when your baby has a seizure. First, don't put anything in your child's mouth. Your child will not swallow his or her tongue. Don't give your child anything to eat or drink, or don't give any medicinal pills or liquid by mouth until your child is completely awake and alert. Then try to keep track of how long the seizure lasts. Your child may be sleepy or may take a while to get back to the normal after the seizure. Stay with your child until he or she is awake and aware, and let your child take rest after the seizure. Thank you. Please do follow the measures if your baby has a seizure. Thank you.
Thank you, Durga Devi. Now I call upon S. Asha.
Good morning, everyone. Today I'm going to tell a small topic in first aid. Let us know what is first aid. First aid is an emergency care given immediately to a person serious position to prevent them from becoming worse and to bring them to better condition. About we have many nowadays children are too smart so that they won't at all hear what is going on, what we tell, even though children will be too naughty and they will keep some objects in their ears or in their what is foreign object? A foreign object is nothing but a small thing which which is in our body, but actually if it is in our ear, what we have to do? Now, babies and toddlers means the babies who are going walk or those who are crawling. It's right to say those who are crawling, they often push some objects in their ears. Do not try to remove it yourself. If we try to remove, we may push it inside so it go a little deeper and it may cause injury to them. Next, if the object is in ear, possible, and keep reassuring them. Always keep an eye on them because they may do something. Always they keep on poking. What we have to do? This is the first aid. What we have to do? What we have to do to the patient who is having an object inside their ear. Use warm water to float it out. Not only for children, even for us, when we are sleeping, sometimes insects may enter into our ear. So that what is the first aid we have to give to them is, remember, first, let them to sit down. Means if the position is like this, you have to make them to sit down and keep their eye upside. Means in which the insect is inside their ear, make them to keep their ear this upside and pour warm water inside the ear. Try to pour water gently, not so too fast, because if you pour too fast, insect may die inside and it may be inside. So pour gently, so that lightly, if you pour gently, that insect may float outside. And insects will be more attracted for light. Means in some villages they try this trick, as insect may come outside, insects will be attracted to the light. So if it's possible, keep keep light focus into the ear so that insects may come through that path outside. Next, if at all the insect doesn't come outside, take them to the hospital immediately. Next, if the foreign object is in nose, if some object is inside the nose, nowadays children will play always. They will put some small, say pencils, like small papers, and some objects they poke inside to the nose and they cry. Then what we have to do means keep them calm. They think something big happened and they may be very getting tension. So that let them be calm and get them to breathe through their mouth. Children don't know, so that they, if some object is inside their nose, they breathe with their nose. So let them to make them to breathe with their mouth. If they breathe with nose, it may go inside. So let them to breathe with their mouth. Stop them poking their nose. They don't know. They think something is inside and they start poking their nose. So them stop that. Make them to stop. Take them to the hospital. Next, what you have to do? You have to remember some things. If something, some objects are inside ear or nose, what you have to remember is don't try to remove the object by yourself. Kindly remember, never try to remember it by yourself. Take them to hospital immediately. If your baby has something stuck in their ear or nose, don't try to take them outside and keep them, make sure to keep them calm. Next, encourage them to breathe with their mouth if an object is inside their nose. This is all what we have to do if something object or some insects are inside in our nose or mouth. So thank you. I thank each one of you to helping me to share this information. Thank you.
Thank you, Asha. Now I invite M. Niharika to share her thoughts.
A warm good morning to one and all who are presenting here. Today I am here to say about the topic what to do if your baby has an electric shock. The causes of electric shock. Currents used in the workplace and at home can cause serious injury. Incidents are generally due to the faulty or lost switches, defective appliances or frayed flexes. Next. Electric shock can also be caused by handling an electrical appliance with wet hands. As water is a very effective conductor for the symptoms and the signs, someone is suffering from the electric shock and may have a burn and a cardiac arrest. First of all, we have to turn off the source of the electricity to break the contact between the electrical, between the and the casualty. Uh, Alternatively, move the casualty away from the source. You may be able to stand on some dry insulating material and use a broom handle or wooden pole to push the casualty's limb away from the source. If it's not possible to break the contact between the casualty and the electric pole with an wooden object loop, some rope around the underneath of the casualty's arms or ankles and pull them away from the electrical source. And also some of the important symptoms of this is lost consciousness even for a second. They are breathing very fast or very slow. Their heartbeat is very fast or very slow or irregular. Next one, if you do not call an ambulance, you should still visit the nearest emergency department or see a doctor as soon as possible. Even if you cannot see a physical injury, an electrical shock might cause an internal damage. Thank you for.
Thank you, Niharika. Now I request K. Jayalakshmi.
Good morning, everyone. I am K. J. 3rd BSc ZNC. Today, I will discuss about my seminar topic, fainting causes and treatment. What is fainting? The medical term of fainting is a syncope. Fainting is a sudden loss of consciousness, usually temporary and typically a lack of oxygen in the brain. The brain oxygen deprivation has many possible causes, include hypotension. Next. People faint for many reasons: standing up too fast, exhaustions, emotional upsets and stress, overheating, abnormal heart rhythm, illness or some medications. Next. Symptoms: feeling of heaviness in legs, blurred vision, confusion, feeling warm or hot, dizziness, floating feeling, nausea, sweating, vomiting, and next. Neurological causes: seizure 3%, migraine rare, cerebrovascular rare, subarachnoid hemorrhage rare. Cardiovascular causes: postural hypotension, hypovolemia drug-induced, dystonia, neurocardiac genetic, carotid sinus, hypersensitivity, cough, swallow, post-micturition, paraneoplastic, vascular defects, cerebrovascular, vertebral basilar insufficiency, subclavian steel, aortic dissections, pulmonary embolism. Diagnosis: tilt table testing, ECG monitoring, telemetry monitoring, implemental loop recorder. Treatment: seeking medical care, faint multiple times, develop chest pain or an irregular heartbeat, experience dizziness or cold sweats, have a family history of fainting or sudden death, make an appointment to see a doctor if you fainted for first time. Make the person safe, lay the person flat on their back. Try to revive the person. Shake the person vigorously, tap briskly or else. Turn the person on their side if they is vomiting or bleeding from the mouth. Do home care for simple painting or healthcare provided. Hit their head when painting. Thank you.
Now I call upon M. Sai Navya to share her knowledge.
Good morning, everyone. My name is N. Sainavya from 3rd BSc ZNC. Now, let me share a few words about dehydration. First aid for dehydration. Drink water, avoid caffeinated, alcoholic, and carbonated drinks. In case of extreme heat or dehydration, replace electrolytes. Introduction: dehydration occurs when fluids and electrolytes are lost due to profuse sweating and not drinking enough water. The person will feel ill and could get incapacitated. Types of dehydration: hypotonic, hypertonic, and isotonic. Hypotonic is a loss of water, and hypertonic is a loss of electrolytes, and isotonic is a loss of both water and electrolytes. Stages of dehydration: mild dehydration, moderate dehydration, and severe dehydration. And these are the warning signs that your body is lacking water, which includes headache, fatigue, joint and muscle pains, and bad breath and dry mouth. And these are the severe signs of dehydration, which includes fainting, rapid heartbeat, rapid breathing, confusion, and feeling dizzy and very dry skin. Treatment at age 1 to 11. Give extra fluids in frequent as small sips and choose clear soups, clear soda, or Pedialyte if possible. Maintain regular diet. Blood test. Blood samples are used to check for the number of electrolytes in body and also for the sodium and phosphate levels in body. Urine analysis. The test done on your urine helps whether your body is dehydrated or rehydrated. Treatment in adults. Dehydration must be treated by replenishing the fluid level in body, and this can be done by consuming clear fluids such as water, clear draughts, frozen water, and sports drinks. These are the homemade remedies for dehydration that includes increase your water intake, homemade ORS, yogurt, banana, coconut water, and watery fruits and vegetables. And this is the Turgor test, which can be done on your hand, and it helps to check whether your body is dehydrated or rehydrated. An adequate fluid intake of humans, which includes men can take 3.7 liters and women can take 2.7, and both boys and girls can take 1 to 1.5 liters, and boys and girls adolescents in adolescence can take 1 to 2 liters. Thank you.
Thank you, Sai Navya. Now I call upon K. Sushmita to share her thoughts. Good morning, everyone. Myself K. Sushmita from Finally at ZNC. Now I want to share my knowledge on importance of first aid in case of nosebleed. Nosebleed. Nosebleed can also occur easily because of the location of the nose and close to the surface of the location of blood vessels in the lining of your nose. Most nosebleeds can be handled at home, but certain symptoms should be checked by a physician. Diagnostic evolution. History, including amount of blood loss, duration of blood loss medication history, side of nose from where bleeding is occurring, and any known bleeding tendency in the patient or family. Careful inspection with the nasal speculum to determine the site of bleeding is very important to determine which site of bleed is first. Laboratory investigations to exclude blood and coagulopathy. Pathophysiology and etiology. Systemic causes are less common. Hypertension, atherosclerosis, renal disease, bleeding disorders, liver disease, hepatic cirrhosis are main causes. Disorders of blood and blood vessels. Aplastic anemia, leukemia, vascular purpura, hemophilia, Christmas disease, scurvy, vitamin K deficiency are most commonly noticed. Are there any different kinds of nosebleeds? Yes. Anterior nosebleed and posterior nosebleeds. Nosebleeds are described by the site of the bleed. There are two main types of nosebleeds and one is more serious than the other. What are the common nosebleed first aids and do's and don'ts when you are prone to nosebleed? Sit in a chair and lean the head forward. Don't lie down or tilt your head back. Pinch the soft part of the nose. Don't blow your nose. Speak or blow your nose. Ice pack on the top of the nose and chin. Do not at all take an aspirin. To prevent the nosebleeds during summer, use the nasal saline sprays or lubricants to keep the inside the nose moist. Avoid smoking. Don't pick your nose too often as well as don't blow it too hard. Steam inhalation can moist and protect the nasal cavity as well as reduce the nasal irritation. As the old saying says, prevention is better than cure. There are some of the protective measures to be taken and should be followed by everyone to avoid and to save ourselves from these terrible disease, nosebleeds. What are the common preventive methods? Wear protective equipment while playing games. Place a humidifier in the house. Do not pick the nose frequently. Restrict taking the aspirin as a blood thinner. Beware of antihistamines and use moderately. Use a saline solution or a gel. Trim the nails frequently. Inhale moist air. Cotton plugs are the most commonly used to clean the bleeding area. Galfoam is most commonly used in medicine when you are prone to nosebleed. Thank you for giving me this opportunity. Thank you, Sushmita. Now, A. Divya is ready to share her thoughts.
Good morning, one and all. Headache causes and treatment. What is a headache? Headache are very common condition that most people will experience many times during their lives. The main symptoms of a headache in your pain or headache or pain. This can be troubling, constant, sharp, dull headaches can be treatment with medicine, stress management, and IHS, International Headache Society. Two main categories: primary headache and secondary headache. What is causes a headache? Inflammation, traction, muscle contraction, vesicular. Inflammation. They are caused by underlying medical conditions such as neck, ears, sinus, teeth. Traction. These are due to inflammation condition in the headache tumors. Muscle contraction. This is tension. Headaches are due to tightening tensing muscles in the face. Vesicular. This is type due to blood flow changing such as from blood pressure. What are the types of headaches? These are more than 150 types of headaches. They are following two time categories and secondary headaches. Primary headaches. So primary headaches are that aren't due to another medical conditions. Include cluster headaches, migraine, tension headache. Secondary headaches. Secondary headaches are related to another medical conditions. Disease of blood vessels in the brain, head injuries, high blood pressure. Four common types of headaches are symptoms duration. Four common types of sinus, tension, migraine, and cluster. Headaches are always classified are either primary and secondary. Primary headaches causes stress, sleep, alcohol. Secondary headache causes infection, sickness. Tension. Symptom dull pain on either side of the head and pressure across forehead. Duration 30 minutes to several hours. Primary or secondary means it's primary headache. Cluster. Symptoms. Pain one side of the head, usually around the eye, with dropping eyelid, small pupil, tearing, runny nose, redness on the same side of the head. Duration several months or several years. It's primary headache. Sinus. Pain in the face, eyes, ear, forehead, itching, runny nose, fever, swelling in the face. Duration several days to weeks. It's secondary headache. Migration. Symptoms. Pain in the face for neck throbbing, one area, sensitivity to light and sound, nausea, distorted visions. Duration 4 to 7 to hours. It's primary headache. Treatment. Pressure down the point 5 minutes. Move our thumb circle while applying pressure. Repeat this process over her other hand. Thank you.
Thank you, Divya. Now I request C.H. Satyabhavana to share her thoughts.
Good morning, one and all. I am Bhavna from 3rd Residency. My topic is importance of first aid treatment. What is first aid? First aid is the immediate assistance given to a casualty or victim of sudden illness or injuries before being taken to health unit for further management. First aider is neither a doctor nor a nurse. Principles of first aid: preserve life, prevent deterioration, promote recovery. Preserve life to maintain the safety and well-being of all those involved in the emergency. Prevent deterioration, carry out a patient assessment and treatment with care. Promote recovery, arrange of medical care and provide first aid in accordance with the training and skills. Emergency management procedure: early recognition and calling for help, early CPR, cardiopulmonary resections, early defibrillation, electrical energy stops coming from brain to heart, ventricular fibrillations, early advanced care. Dr. ABC. What is the Dr. ABC's first aid treatment in emergency requirement victims classified into Dr. ABC? D for danger, R for response, A for airway, B for breathing, C for circulation. D is for danger to yourself, to other, to casualty. First aid treatment for the victim is classified what we do and does not do. What we does before handling the casualty: use mask, gloves, hand cover, and apron. What we does not do: first aider can never prescribe medicine and declares death. Thank you.
Thank you, Satyabhavana. Thank you all for sharing your knowledge. Now Sitara is here to propose vote of thanks.
A warm and cherished morning to one and all. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked hard to make this program successful. On behalf of everyone, my sincere praises to Lord Almighty for His blessings and abundantly. My special thanks to most respectable superior of correspondent of our college, Reverend Dr. Sister Marietta Pudota, for her decorum. My heartful thanks to our multi-visionary principal of our college, Reverend Dr. Sister Marietta Di Mello, for being backbone of today's webinar. Please accept my deepest gratitude. Reverend Dr. Sister Shauri Lu, Vice Principal of Degree College and PG Directress. My wholehearted thanks to Convener of Dr. R. Indira Ma'am, Head of the Department Zoology, for her outstanding action plan for conduction of the program. My sincere thanks to staff members of Zoology Department and presenters of today's webinar. My dearest thanks to Mr. Tommy sir, Sharif sir, and all the technical supporters. Once again, I thank one and all for sharing your valuable time and making the session more knowledgeable. Thank you.
Thank you, one and all.
Thank you, one and all, for your listening and also witnessing our workshop. Thank you so much.